So thank you, dear Steffi, dear DLD community. Do you remember Udo Lindenberg's, Udo Jürgens? Do you remember him? Do you remember the song? Mit 66 Jahren, da fängt das Leben an. Mit 66 Jahren, da hat man Spaß daran. Don't worry, I won't sing the entire song. You don't want to hear that, and I'm only allowed to, I think, to talk 5 minutes. That's very short, so, and DLD and Steffi is very strict about this. So he sang, "At 66, life's just begun." And in the 70s, those words were still meant ironically. Back then, most 66-year-olds were, well, old. Today, things are very different. People retiring today often have decades of good health ahead of them. For quite some time now, we have been a society of centenarians. Statistically speaking, we will live longer than our grandparents and our great-grandparents. This isn't a new realization, but it is one that concerns us more and more every day. This development is still ongoing, and it opens up many opportunities for us. We will be able to shape our lives much more freely and individually than 100 years ago. Unlike now, we will be able to experience several different phases of family, work, and education. Let me give you a few examples of what that means. Instead of spending 20 years in a row at school and university, and then that was it, the sensible and necessary move will be to engage to continuing education. And it won't be unusual for people in their late 40s to go through longer learning phases and to start out on a completely new career. Lifelong learning is extremely important for the new longevity society. Now, let's look at the world of work. If we take the society of centenarians seriously, a fixed retirement age, that makes no sense. Instead, we need to think about how to organize a gradual retirement from working life. The same applies to the challenging period people experience in their mid-30s, a kind of rush hour when they are expected to raise children, have a career, and possibly build a house, all at the same time. In the longevity society, these tasks could be spaced out. But as a society, we are currently still unprepared for this. We also need to discuss the really big questions that arise from the findings of longevity research. How long will we have to work in the future? How do we finance the society of centenarians? How can we make it fair? This brings me to the health policy challenges. All these findings and questions mean that we need to fundamentally change our healthcare structures. It's no longer enough to rely only on acute medical care. We need to move away from repair care and towards a preventive system that maintains health before illness occurs. The way our society thinks is very different today from what it was 20 years ago. Health is understood not only as medical care, but as a holistic approach of life. Of course, this is also reflected in our politics. We call this health in all policies, because people want offerings that fit in their everyday lives, and above all, self-determination. Better access to technology, support, education makes it easier to live a healthy life. This means we have to rethink the established structures in the healthcare system. So how can we bundle preventive services and make them accessible to everyone, regardless of their age, their gender, and of course, their financial resources? To minimize the burden of disease, it's crucial to strengthen health promotion and prevention in the long term. In Bavaria, we are pooling all our strength in the prevention master plan. It's no coincidence that our ministry now even has prevention in its name, the Bavarian State Ministry of Health, Care and Prevention. As you can see, action is the order of the day. And of course, Steffi, communication. Because one thing is clear, people cannot be made healthy by a decree from on high. We need a society to make a collective move. And this requires role models, networks and offerings that help people to stay healthy. That's why we are here today, and the reason it gives me the great pleasure to speak to you today. After all, nothing less than people's future is at stake. So let's make a healthy future. Thank you.